Thank you so much for joining us this morning at 9 a.m. Hopefully you've had a chance to have a little sip of coffee, stretch your legs, all that wonderful stuff. So today we have a few people on this call to us to bring really exciting news about continuous eligibility. And I want to go ahead and introduce them here in just a moment, but first I will introduce myself. So I am a regional outreach coordinator supporting Washington County and Columbia County. And I've been a part of the Community Partner Outreach Program for a little over a decade now. So basically what I do is support you all, community partners, specifically more in my region, Washington County and Columbia County, but also just really any partner who reaches out and is looking for guidance around assistance with the Oregon Health Plan. And more recently, for the last 3 years, I've spent quite a bit of time getting feedback and gathering with a lot of you all, with a lot of our community partners to collect input on Oregon's 1115 Medicaid waiver. So for those of you who are not familiar, we will talk about that here in just a moment. And now I will turn it over to Fabi. Fabi will be introducing herself, and we do have some members of our policy team here today to answer some questions. They're wonderful, knowledgeable, and here to support you all. But of course, you know, we have quite a bit of a large group today, so they may not be able to, there might be moments where questions will be answered in the chat box and other opportunities where we will be able to unmute the policy team to speak on different topics if that's something that is appropriate. All right, Fabi, I will go ahead and turn it over to you. Thank you.
Thank you, Ruby. Good morning, everyone. This is Fabiola Herrera. I'm one of the regional outreach coordinators with the Community Partner Outreach Program team. So really great to be here with you all this morning. I do serve primarily the Willamette Valley region, although I get the opportunity to connect with folks all across the state as well. It's really great to be here. Thank you, Ruby.
All right, and I will just wait for you to kick us off and advance our slides. Thank you, Fabi. So today we will be talking about Oregon's Medicaid waiver and how that relates to what I've mentioned earlier, continuous eligibility. I'm sure some of you have kind of heard some whispers here and there, or even, you know, really big news in our newsletters. And there might be a few of you who are new and just getting started. So some of these terms may be new to you, and that's totally understandable. It's okay. If there is something that just does not make any sense whatsoever, please let us know, and we will go ahead and make sure to expand. So we want to make sure you all are comfortable. This is a safe space to ask as many questions as you need if something's just not making sense or even just defining a term. We're also going to talk through some scenarios that will hopefully paint a picture for what we're actually talking about and really get us on the same page when we're talking about continuous eligibility. In addition, we'll touch on some resources, and then we'll have an opportunity for questions, and we will do our best to answer the questions that we can, and anything that we are unable to answer, we're happy to circle back. Thank you. Okay, so just want to reiterate some of the members of our policy team that are here with us today. We have Christy Garland, Jewel Kostrom, Christy Taylor, and Janelle from Aging and People with Disabilities. So a very well-rounded, robust group of people with all sorts of wonderful knowledge. That said, I'm sure you all are going to come with fantastic questions, and there's probably going to be things that we can circle back on later. Thank you, Fabi. Okay, so if this is your first time using GoToWebinar, or if you're like me, I haven't used GoToWebinar in 3 years. I've become a Zoom girl. That's right. I actually own a Zoom shirt. That's a long story, but I'm all about the Zoom. So I'm going to be right here with you if you're new to using GoToWebinar. You'll notice an orange button. It says click on the orange arrow to view the control panel. So that will really just kind of help you get a good idea of all your options and your dashboard, so you can kind of look at the different drop-down menus and different functions you need to utilize. The control panel also has a wonderful place for Fabi to drop in any handouts. Those are PDF files, so you should be able to hopefully pull those up. If for some reason you don't have the right software to find these handouts or it's not working, let us know. We can email them to you, or I believe they do get posted to group site. And then we just want you to know that you do have an option to select your preferred method of audio. So if you want to listen in via computer, you can select that. Just click on that radio button, computer audio. Or if you're interested in taking the audio by phone, you also have that option as well. Thank you. Next slide, please. All right. So for those of you who have not heard of the 1115 Medicaid waiver, I'm just going to give you a really quick overview on what we're talking about. Next slide, please. So just a reminder, I know a lot of you have great experience, years and years of experience, and you know that Medicaid is a state and federal program, but because we do have a few new OHP assisters every month, we want to just go ahead and remind you what we mean when we talk about Medicaid. Now, a state must apply for a Medicaid waiver when it wants to make changes from normal federal guidelines. So think about all the times we meet in community partner collaborative meetings and you have all these candidates make these levers turn here, and it can get a little complicated. So essentially, you know, there are federal guidelines and there are times where we have opportunities, you know, every so often, so every 5 years generally, to make changes. And so for those of you who have been a part of the Medicaid waiver meetings, we've been putting out announcements about the new Oregon Health Plan. And when we talk about that, we're really just trying to grab your attention and we're trying to say things are changing. So this Medicaid waiver is an option for us to look at what could work better and sort of experiment with some things that, you know, you may have brought to the table. So this is really a exciting opportunity, and I know it can be a little easy to just kind of gloss over, but it is really a very important topic, and it's really critical that we have you attending our Medicaid waiver meetings. So more on that here in just a moment. So if you haven't heard about Oregon's Medicaid waiver, I will be talking about where to get updates and how to participate in those community partner engagement meetings. Making these changes, oops, sorry, we go back to the next, the state can ask to sort of waive or change certain regulations so that we have flexibility to build the Oregon Health Plan in a way that'll work for your communities. So the things we can change are things like who is eligible for Medicaid, what benefits they receive, and how healthcare is delivered to Medicaid members. Next slide, please. Now, the purpose of our waiver to demonstrate or transform our Oregon Health Plan to work better for your communities. Now on September 28, 2022, CMS provided Oregon with the final decisions on what was allowed in sort of transforming the future of the Oregon Health Plan. And a lot of those ideas came from you, from our community partners who participated in our Medicaid waiver meetings in years past. Now, most changes will begin in 2024 and some will begin in 2023. More importantly, when we're talking about Oregon's Medicaid waiver, we really are honing in and focusing on addressing health equity. So this is really a central point. You know, anytime we're talking about implementation, this is going to be, you know, our guidance. It's sort of our guiding light, is that the whole point of our Medicaid waiver is to address health equity. Next slide, please. Now, a lot of you are familiar with the public health emergency unwinding, and we want to talk today about how that relates to continuous eligibility. So by now, you know that people who received coverage during the public health emergency, they will continue to maintain their benefits until it's time for them to renew after April. So this is really due to the policy allowances during our public health emergency. But even more exciting, effective July 1, Oregon received approval through our 1115 Medicaid waiver to expand this continuous eligibility to longer coverage. Next slide, please. Bobby, will you advance the slide, please? So
Can you
do
see
we have a
the screen
question?
now?
Right now we still have, I still see the same slide, the public health emergency unwinding and continuous eligibility slide.
Okay, my apologies. I am moving, but apparently my GoToWebinar decided not to move. So give me a second.
That's okay. I'll give you a moment. And then just while you're doing that, I'm happy to talk about the next slide, since since we already know why this is happening. So some of you are probably wondering, you know, why is this happening? But I would say probably most of you are thinking, finally, because this feedback actually really came from our community partners telling us stories of how churn or people sort of bouncing from OHP to marketplace plans and then back to the Oregon Health Plan was causing a disruption in things like CCO enrollment and healthcare access and prescription coverage. So really the goal is to make sure we're reducing that disruption, and it will also allow us to reduce the state's current uninsured rate of 6% to below 2%. So this is something that, I know that sounds amazing compared to years ago, but it is something we really want to, you know, we want to make sure we really improve on. As much as we look at that 2%, it really matters. So we're really trying to be more inclusive. And with that, eliminating the racial and ethnic inequities in our uninsured rates that we currently have been experiencing. I think for those of you who are numbers people, you know, people that talk about the bottom line, I mean, you can only imagine the cost that goes into, you know, people not having care or delaying care and not being able to access their health coverage because they're moving in and out or just, you know, churning back and forth between marketplace plans and OHP. Not only for our health system, but also for a family. I mean, there could be a major surgery that could literally result in a family having to file for bankruptcy or not being able to pay, you know, their regular bills. So this has been really exciting, and we are just so grateful that our community partners have been advocating and showing up to meetings and saying, this is what we want, this is what we need. So thank you for all the time, for all of you who attended these community partner waiver meetings and provided this input. All right, well, I'm going to circle back with Fabi and see how things are going.
I think this is one of the areas or the pieces that we have kind of briefly reviewed previously. We know that there is some connection to the end of the public health emergency, but that basically we just wanted to kind of dive deeper into who is this really applying to. Basically, eligible individuals will have a continuous eligibility period added to the record in one, and applying to folks that one are eligible for and receiving coverage on July 1st of this year, as of the beginning or the start of this month. But then the second one is that they have either undergone the public health emergency on 1 year renewal that we know started on April 1st, or that they're just new applicants and then they were approved after April 1st. So this is a really important piece, because I want to kind of get us back into the differences between the continuous eligibility policies that allow us to have everyone enroll in benefits during the public health emergency period. Those ended on April 1st. Then we started to do those renewals after the end of the public health emergency, which is really what the unwinding piece means. It's just that renewal after the end of the public health emergency. And I think we can perhaps go to the next one. All right. So one of the things that we also want to make sure to share with everyone is when are things or changes happening on the system. So when are we going to be able to see that in one? There are actually two phases. We're going to be able to see a couple of phases here for those updates. On phase one, which actually started last week, so July 19 of this year, so last week, in the one system, we'll see that added expanded continuous eligibility policy. More than anything, it will be the functionality that we'll see in the system. And really important to know that during this phase, renewal days will still be set at 12 months. So you might be wondering, like, so continuous eligibility for everyone or most folks age 6 and older will be for 2 years. But yes, during this first phase, we'll still see those renewal dates set at 12 months. And an important noting here also is that although phase one will be implemented July 19, this policy is effective July 1st. So anyone that renews between April 1st and July 19 will be picked up in the system for the implementation, and they will receive the new continuous eligibility periods. Now, the phase two this phase two will be deployed in early 2024, so this coming year. So these will happen before any of the 12-month renewal dates come due, and will include that functionality. So more than anything, these phases is for us to understand that the functionalities that are being built into our one system, where folks apply and get their benefits. And then that functionality to basically recalculate those renewal dates for those previously assigned a continuous eligibility period. So one of the things that we'll be actually looking into in the next few slides is a sample of a notice. So more than anything, be aware that this is there are a couple of phases where continuous eligibility will be functional in the one system, and we'll look at one of the examples of what a notice will look like in phase one. And I think we can go to the next one. Awesome. Okay, so when does the continuous eligibility period begin? And I think this is just kind of another opportunity to emphasize when does that continuous eligibility period is established for a case or for a person. This is established when the one system determines that a person or an individual is eligible at initial application and also at the time of renewal. And note important here is also a continuous eligibility period is only locked in once eligibility is confirmed and all requests for information have been cleared. So we have an example of this in the next slide, but just get us thinking about it. Just think about when someone is approved for benefits right now, they are approved, their benefits start, but then we might still need to see some information. Like, for example, we might still need to, verify income. So we send that RFI for income verification. So once we get that information back, then that is in this case, what it's trying to say here is basically that's when we verify that information is when the continuous eligibility period will be locked in. And yeah, we can go to the scenario. So very simple scenario for us to kind of look at. So let's say on November or September 10, Sheena is approved for benefits and is pending for review for income. So benefits are approved, and then we send maybe a request for information, an RFI, to verify that income. So then Sheena turns in the income information before the due date. What this does is that clears that RFI, and then at that time is when continuous eligibility period is now kind of locked in, is active, because all RFIs on the case have been clear. All right. Perfect. So one of the important things to also note is, why is this change important? And I think just getting us back to that, the initial background information that Ruby reviewed with us, many people who lose OHP health insurance are only ineligible for short amounts of time, and then they rejoin OHP. This on and off, some people also know this as like churn. This on and off OHP results in poorer health outcomes. So basically, continuous eligibility is really a valuable tool that will help, members, that will help individuals stay enrolled in the health coverage for which they are eligible and have consistent access to those needed healthcare services. So the state, as we know, as we have reviewed briefly already, the state will be providing that continuous 2-year eligibility. Sorry, I think I see a minor typo here. So that 6-year period eligibility for children, and almost the 2-year for almost everyone else, 6 and older, regardless of the changes in circumstances that will otherwise cause that loss of eligibility. So really important change to ensure that our communities in the state have better health outcomes. All right, so if we can go to the next one. All right. So also thinking about the changes reported during the continuous eligibility, and as some of you might be having a lot of questions about this. So it's important to know that during the continuous eligibility period, members will continue to receive the same level of coverage throughout the entire continuous eligibility period, the CE period. However, they might actually move between medical programs within the same or higher, benefit level. So we have a very quick example here to kind of help us understand this concept. For example, we know a veteran dental. We know veteran dental is only dental benefits. So it's all the dental benefits that any other OHP member will have, but it's basically only dental. So a veteran dental recipient with an active continuous eligibility period will be allowed to move to an OHP plus benefit, because OHP plus benefit is a higher benefit level during the continuous eligibility period. Maybe let's say that they report during this continuous eligibility period, their income decreases to the level in which now they qualify for a better and higher benefit level. They are allowed to move to that better and higher benefit level. All right, so if we can go to the next one. Excellent. So another note on requests for information, or RFIs, during the continuous eligibility period. So once this continuous eligibility period is active, if a change is reported, an RFI will only be generated if the change could result in a better or additional benefit. So, I mean, we just reviewed that example in which a person is moving from dental only benefits to full OHP benefits. The one thing that we do want to note with everyone is that the request for citizenship immigration status, identity, and social security numbers will continue to be sent. So those RFIs will continue to be sent during periods of active continuous eligibility. All right, if we can maybe move to the next one. Excellent. Request for information. Again, we do have a quick example here. As a quick reminder, that RFI is generated due to potential eligibility for a better or additional benefit. So sometimes it could be an additional benefit. Existing coverage will not be impacted negatively for the member in case, for example, that they fail to respond, or if they respond by providing information that will result on them not being eligible for that. So we have a very quick example here. So Juana receives the parent caretaker relative program, and then Juana starts receiving Medicare. So in that case, Juana will get an RFI as she might now qualify for an additional benefit. So in this case is the Medicare Savings Program benefit. So, but important to know that if Juana does not respond to the RFI, this will not affect her existing benefit. So she'll be able to continue on that parent caretaker relative program if she does not reply, or if she does not qualify for this other benefit. All right, thank you, Ruby. So now we can see that example that I was referencing to back or previously. This is the notices, a little bit more colorful than they were a few years back or a couple of years back. So on the approved benefit section, we can see, so for example, in this case, so this person was approved for the Magi parent or caretaker relative, and their benefit is start date September 1st. But as you can notice, their benefit renewal date is set for 1 year. So this is a perfect example of the notices that you will be seeing on this year. So in this phase 1. So, however, if you notice just down below the information on the program, you can tell that the continuous eligibility period is noted here. So it's now a 2-year continuous eligibility period. However, the renewal date was set for that first year. And then you can see that as well for the other household members in the notice. A really important note on this notice of eligibility is will be basically the notice of eligibility will be updated to display this continuous eligibility information. But the continuous eligibility period will only be displayed on notices once the continuous eligibility period is logged in based on a full determination. So after that example that we review, after RFIs have been clear. And then also really important to know, so we kind of highlighted it a bit more in here, is the continuous eligibility dates will not be displayed anywhere else in the One Applicant portal. So you as a community partner might be able to go into the portal, and if you might be wondering where you might be seeing this information about continuous eligibility, so the best place to look for will be on the notices that are sent to the member. All right, and if we can move to the next one, perfect. So we have arrived to the almost the end of the presentation. So this kind of intro to continuous eligibility. We do have some resources for you. We again briefly review waiver website and sign in for updates. So I highly encourage you to visit the waiver website. There is more information on the background and why these and other changes that are coming on the next years are really important to keep our communities healthy. We have the waiver team email. Highly encourage you to connect with them, to reach out to them with questions, with feedback. Please reach out to us as the CPOP team with questions, with feedback, anything that you might want to share with you. But we also have some member facing and support materials that are coming soon. So very soon that they might be ready at the end of this week. So we'll be sharing those with you as well. But there will be some more information coming out for member facing and materials that you can share with the community members that you are supporting. All right, and we have arrived to the questions. I know I see that the chat has been really active, and I wanna, so in this section I do maybe want to pass it back to Ruby and see if you can help us facilitate this Q&A section, Ruby.
So Sophia asked if healthier organ program recipients are able to have continuous eligibility. I believe we got the answer to that question this morning, right, Bobby? That is yes, that is correct. That people who have full OHP benefits due to the Healthier Organ Program initiative will have access to full benefits and continuous eligibility. Is that right, Bobby?
Yes, can you hear me?
Yes.
Yes, that's correct.
And then I feel like, Fabi, you and I may have answered this in the slides. There were some exceptions in which if people moved with continuous eligibility, I see Sonia Matlock's question. Sonia is asking, what will happen with people who move out of the state during their 2-year period? So I believe if they notify us that they are moving, those benefits would end. Is that correct?
Ruby, that is also my understanding. I know we didn't cover that in depth, but that is correct. So it's OHP benefits continue. They apply for folks that are residents of Oregon. And I will, I'm not sure if our policy experts would like to add more information to that, but that's my understanding as well.
I'm sorry, I was really distracted typing answers, so I didn't hear the question. I think it was, what if a person moves out of state in the midst of their CE period? Is that right?
Yeah, so if we were to be notified that somebody has moved during their continuous eligibility period, if they're leaving the state, would their coverage, what happens in that situation?
Yes, moving out of state is a condition where eligibility would be terminated, even if they have an active continuous eligibility period.
Okay. Yep, that's what, so yes, that's the information we had as well. So Patricia, Pat is asking if a request for information has been submitted, how long does it usually take to process the task? I feel like, that just really depends on what was submitted and if it was submitted accurately and the staffing available to process that. But maybe there's someone else who could, is there like a hard and fast rule or guarantee that an RFI will be processed within 24 hours? Yeah, I don't know that we can really like speak to processing right now. So yeah, I think that just really depends on, it's not something we can speak to. So essentially, the answer is, Pat, the answer is it depends. Thank you for that question. And then Melody, we will probably need to get more information or circle. Yeah, we need to get more information about your question. On the eligibility example where it listed a child age 4, it does show 2 years. However, does the date of birth play in so the child gets eligible until end of birth month?
Yeah,
Oh, go ahead, Jewel.
the brief answer to that is that children will be guaranteed coverage through the end of the month of their 6th birthday or 24 months, whichever is later. So in scenarios where a child becomes eligible with less than 2 years until they turn 6, they'll get the full 2 years instead of through their 6th birthday.
Okay. All right, so there's a lot of really good questions coming in. I really appreciate that people are kind of thinking about everything they just learned and give questions here. Anna wants to know if someone who was approved for Healthy Oregon last year reported income in June 2023 was determined over income last year. Reported income. Okay, I see. So somebody that you're working with was approved for Healthy Oregon last year. They then reported their income June of 2023, and they were determined over income and were informed that their eligibility is ending August 31st, 2023. Okay, I think what you're asking is this person eligible for continuous eligibility?
I just sent the text response to that question.
Thank you,
and it's just a
Jill.
little, the policy becomes effective on 7/1 or became effective on 7/1. So folks who were eligible for and receiving benefits on July 1st are entitled to continuous eligibility. But if they were receiving benefits but not eligible, meaning that they were set to terminate because of a loss of eligibility, they won't be picked up. However, if this person, despite not being picked up in the data fix to have continuous eligibility assigned to the people on the case when we implement it, anytime that they reapply, if they're reevaluated to be eligible, continuous eligibility will be assigned to them.
All right. And then Laura is referring to what the one system will show for continuous eligibility. So my understanding from what Fabi was talking about is that their letter of correspondence would indicate that, I thought. Let me see if I can go back to that slide. Where did it go? I might have just
the notice the notice image had that information. Yes, yeah, that's a great question, great clarifying question. Because where you might be wondering where on their account or the dashboard you can find that information, and the best way to locate that continuous eligibility period will be on the notice.
So partners would have to log into the One System applicant portal and pull the notice to see this. There isn't going to be like this pop-up screen or something that just is right, you know what I mean? It's not like in their dashboard, but it's more, they have to actually search and look for the notice. Is that right?
That's correct, as well as to my understanding of the.
Yeah. So Fabi, Ryan is saying he just needs some more clarification. So Ryan, what Ryan is saying is he thinks he's hearing that clients will have continuous coverage unless they lose coverage, in which case they have to reapply and they'll be eligible again.
This is Jewel. I think confusion here is about the transition, like during the period of time where we're implementing the policy. Mm-hmm. If an individual is eligible for and receiving on July 1st, then they won't be entitled to continuous eligibility based on their existing eligibility on the system. But if they reapply and are found eligible, then continuous eligibility would be applied to them as it is to everyone. But once a continuous eligibility period is in place, once a person, after the continuous eligibility policy effective date of July 1st, once a person receives a continuous eligibility period, that continuous eligibility period will be maintained regardless of changes in circumstances, with just a few exceptions that we have mentioned in other questions, which are things like citizenship, identity, or moving out of state. Those are the kinds of things that can impact eligibility during a continuous eligibility period. Other changes in circumstances will not. So those folks will maintain coverage for 2 years or through the end of this month of the 6th birthday, whichever is later.
Ryan, I hope that clarifies. Ryan says, got it. So there's like a one-time need to reapply in order to qualify. I hope I'm understanding it correctly. That makes sense. Yeah, I mean, this is probably not the greatest comparison, but it's sort of like, you know, I think about like if you miss a sale, the sale started a specific day and you're trying to kind of like retro get the deal. It's more, maybe I'm causing more confusion. I shouldn't even say that. I think the example that we talked about earlier just felt a little convoluted, but you made it, I feel like you made it pretty clear, Jules, so I won't even bother with putting in. He says, I think I get it. I think it's going to take some time to wrap our heads around this. I really do. We've done it this, you know, we've done this the same for so long, and it's a different way of thinking. There's a lot of dates involved and numbers involved. So totally understandable. We're going to keep having this conversation. This isn't the only conversation we're going to have. This conversation will come up in collaborative meetings as we start to see things unfold. I'm sure we will circle back with you and dive even deeper. So don't feel like this is the only opportunity to learn about continuous eligibility. It's a really big expansion, and so we will continue on. Yes, we will be following up with the slides for anybody who registered. And Ryan, I noticed that you said this is going to be a big deal for a lot of our clients. I am really curious about that. Yesterday, we received a request for collecting stories as to how this will impact your clients. So, if you're interested in sharing, I'm going to send you my email, or if anybody is interested in sharing, go ahead and send me if you have a story or scenario or just a success story, something you'd like to share. Let us know. We are collecting stories. If you can think of specific families or individuals where you're like, oh my gosh, this person used to go on and off OHP, or it was so hard to keep them on and it's disrupted their care, and now this is going to make such a difference. Any specific examples or success stories, feel free to send them my way, and I've included my email address here in the question box. It should be visible to everyone. Actually, I'm going to update that email. Just realized I put in .us instead of .gov. Thank you so much, everyone, for your time today. We appreciate you being here. If you're interested in going through this presentation again, because I know you all enjoyed it, in Spanish, Fabi and I will be facilitating another presentation next week, I believe, or here pretty shortly. Fabi, do you have that date off the top of your head?
Yes, that is actually, you're correct that it will be the first Wednesday of August. So a week from today, we'll be kind of doing that review in Spanish as well.